APS therapy stands for Action Potential Simulation. It's using an APS therapy machine, and an APS therapy machine sends a copy of what the body's, they're called action potentials, and what they basically are is the nerve signal, the little electrical impulse that travels down nerves. This asks the cells to communicate with each other more effectively. And the overall result that we're looking for is a reduction in pain, and people with MS seem to respond very well to this, and some people also have a reduction in their fatigue and an increase in their energy. So it involves sitting down, so if people are at home using one of the smaller home machines, they might just be watching telly or, you know, just relaxing. Here in the clinic we've got the larger clinic machines on the tables, and people who are able to themselves can put electrodes on the end of the wires and then stick the electrodes onto their body. You basically have 4 8-minute sessions that run back to back, so the whole thing takes just over half an hour, where you sit and have the electrodes on your skin and turn the machine up, feel the tingle, and then you actually turn it down. So it's something where you can't actually feel necessarily after that first tingle whilst it's happening. So it's painless, and it just involves sitting down for just over half an hour.
To get the optimum benefit, you need to have 2 to 3 sessions of APS therapy a week, and we usually do this over a 6-week period initially.
So APS therapy may, in some cases, in things like injury and joint pain, sometimes is able to completely resolve a pain over a matter of weeks. But often in MS, when people have nerve pain, that is an ongoing problem which needs maintenance. But if APS therapy works for a person with nerve pain, then it is likely to have a much more lasting effect, so over maybe 4 or 5 days before a person needs another treatment. So in our clinic, after the first active period of 6 weeks where people are doing it 2 or 3 times a week, there's a lot of people who over the years have been just coming once a week, and that's been enough then to maintain the benefit.
There are no side effects attached to having APS therapy other than if you don't drink enough fluids. You could develop a slight headache. You need to drink around about 1.5 litres of water a day throughout the course of treatment, and that's not just on the days that you're having the treatment, that's every day, just to keep the body well hydrated.
I started coming here probably about a year ago, I think, though I only started having APS about 9 months ago, as I didn't think that it would have any effect on me. But I have suffered from trigeminal neuralgia, and it has been the bane of my life for about 15 years. I've had 13 full operations on my brainstem, and now I've lost all the feeling in one side of my face. When the pain returned on the left side, and I was told that there was a chance that APS would help, I started having it, and yes, it has helped tremendously. I can't begin to describe how nice it is not to have that pain coming back all the time. I'm hoping it carries on. It's amazing that I don't have to worry. I can brush my teeth, I can eat what I want, yes. The pain that was there nearly all the time before, I haven't felt for a long time now.
The reason why I come here is because I was losing all of the sensations in my feet, and especially in the cold weather my feet were freezing and my legs are really cold. I've been told that I'd lost all, my nerve endings were dead in my feet. So when I started coming here, I explained it to Heather, and we started doing this water therapy. Now I get pins and needles in my feet. The temperature's proper now. It's hot when it should be, cold when they should be. Yeah, it's been a godsend, to be honest. When I haven't had it done, my brain doesn't really talk to my feet very well. So I'm always walking into the side of doors or into skirting boards because I can't judge where things are. But when I've had this done, my perception is much better. I've not been able to come here for 2 weeks and I've really noticed that I haven't had the treatment at all. So having this done today means I'll be able to feel my feet again and stop falling over as much.
It helps with, because I get tired quite a lot, you know, fatigued and everything, and I've noticed that because I'm coming twice a week, it really helps me. So like when I've come out of here, I'm got more energy, and then like when I'll leave it for a couple of more days and then I'll come back, and I mean, that's great. But if I miss a day, I really notice it. You know, I really get tired again. So that's why I think it's brilliant. You know, it doesn't, and it also helps with, because I've got pins and needles in the right side, and they were starting to go into my left leg. And what happens now, it seems to have subsided, and it's much better. And sometimes it's not there at all. I've noticed that I'll sleep better. You know, like tonight I should go home and I should sleep well. Probably a couple more days I should be, you know, a bit restless. But when I come again on the Thursday or the Monday, when I go to sleep at night then, it's brilliant. I'll get a good night's sleep.